Viewers, very important, many people ask this question, which I am going to post to Dr. Sridevi. Can you share about travel in pregnancy, doctor?
Yeah, sure. Thank you. So usually travel in pregnancy in the first trimester, if it is absolutely necessary, that is you have to go, then you can travel. And the best means of travel might be by car or train. And if possible, you can split. Like for example, if your journey is going to be for 8 hours, we don't want a continuous 8 hours travel, then you can split it into like 3 to 4 hours break, and then you can travel so that your legs doesn't get cramps, you're not in the same position, so you have some space to move around and then get back to travel. So there's no history of any thrombosis. And if you have no problem, then it's okay. Otherwise, if possible, you can postpone it to the second trimester. That is, after 3 months, then there's the risk of abortion generally decreases. So overall, the travel might be much safer. And same way, you should not travel during nearing term, because nearing term you might expect for example 36 weeks, you don't want it to deliver that time, you want it to deliver automatically when your body is ready. So that may precipitate contractions. So preferably it's better to avoid, but if it's necessary, then you can go. Some people can ask whether we can travel by flight. So by flight, again, if it's necessary in the first trimester, it is better to be avoided. But if absolutely necessary, you have no choice, then you can travel. But who should not travel is if you have a high risk pregnancy, that is you have repeated abortions, or you have some spotting or bleeding, then that is going to increase the chance of abortion. Then we don't want to take a risk. If it's absolutely normal, you are having a healthy pregnancy with no previous complications, and at the same time this pregnancy you have no complications, then it is okay to travel.
Yeah, see, travel, you have to use your common sense. As rightly said, first 2-3 months is better, but it's absolutely necessary. You have a family urgency, then the mindset becomes upset. Yeah, I cannot travel. See, for example, you want to see your close relative which is very sick or something like that, then you have to go. It's okay, but ideally, most of the time, if not necessary, try to avoid. That is the indication. And second trimester, very safe to travel. As I said, breaks. And you are going in a flight, probably you may require some oxygenation. So you have to tell the flight attendant whatever it is, or you have to keep it ready, because the breathlessness, or you feel little bit dizzy, then you have to take care of yourself. Anytime the pain or giddiness or some kind of uneasiness in the body, you just break. And oxygenation should be given. The main issue there is oxygenation. And the pain should not come, because pain leads to contraction of the uterus. Then they can go for delivery. And the train is a good mode of delivery, and be comfortable. Take a first class ticket, or preferably in a car, not in a very jerky, in a very road, probably they show in a movie also. They go and just deliver on the road if they go. That kind of things is better to avoid. And
long travel, why usually we don't want this? Because long time when your legs are put down, the blood flow increases to the legs, because it becomes dependent. So what happens is the uterus doesn't receive that much blood. So usually when you feel like that, it's just a leg elevation. For example, you travel in the car, you can raise your legs a little bit, then the blood flow is good to the uterus and the baby.
Yes, a massage to the leg can be done. Maybe stockings they can use the stockings, because the blood should not get accumulated in the legs. That is the idea. Okay, doctor, thank you very much.
Thank you.